Right, Erica.
Hi, I would like to welcome all of you to the Lunch and Learn today on navigating common interventions in autism spectrum disorder. I'm Erica Hurdle with the Regional Autism Assistance Program and a member of the Autism Society of Iowa Education Committee. I'm pleased to announce our speakers. Leslie Rogers, MS, CCC-SLP, has a variety of experiences in speech and language therapy and working with children with autism. She graduated from the University of Nebraska-Lincoln with her Bachelor of Science in Education in 2000 and her Master of Science in Speech Language Pathology in 2002. After graduating, she worked for Omaha Public Schools from 2002 to 2007 as a speech and language pathologist. Leslie then moved to Des Moines, Iowa, where she started work at ChildServe, a nonprofit specialty healthcare organization focusing on pediatric rehabilitation. Leslie is currently the Vice President of Outpatient Services and oversees outpatient rehab, behavioral health, DME, and physician services, in addition to staying involved in the autism program at ChildServe. In 2019, she became a board member of the Autism Society of Iowa and has enjoyed providing educational topics both internally at ChildServe and for external events across the state. In her free time, Leslie enjoys spending time with her husband and 2 kids, watching and attending sporting events, watching movies, and volunteering at schools. Kristin Hanson, MA, BCBA, LBA. Kristin is the CEO, founder, and clinical director of Access Therapy Centers, a multidisciplinary clinic that provides services to families living with autism and special needs. She is a licensed and board-certified behavior analyst and received her Bachelor of Arts degree in psychology from Grandview University and her Master of Arts degree in child and adolescent psychology, followed by a postgraduate certificate in applied behavioral analysis from the Chicago School of Professional Psychology. Most of Kristin's clinical experience has been focused on the early detection and intervention of autism spectrum disorder and specializing in early intervention. She is on the board of directors for the Autism Society of Iowa and a member of the Autism Expert Panel for the Iowa Regional Autism Assistance Program. Kristin currently oversees 4 clinic locations in Ames, Ankeny, West Des Moines, and Fort Dodge. In her free time, she enjoys spending time with her husband and 3 children, reading, listening to podcasts, going to sporting events, attending concerts, and coaching her children's sports teams. And we're happy to welcome you, Leslie and Kristin. I'll let you take it from here.
Thanks, Erica.
Thank you, Erica. Leslie, are you controlling the slides?
I am. There we go.
Okay,
Ready.
perfect.
Okay.
Right. Hi, everyone, and thank you for spending your lunch hour with us. Our learning objectives for today are going to be to discuss the range of interventions available for individuals with autism spectrum disorder, including behavioral and therapeutic approaches, to identify principles and strategies underlying effective interventions, and to recognize the importance of collaboration among families, educators, therapists, and healthcare professionals. There is a wide range of interventions available for individuals with ASD, and just an overview of those areas could be behavioral, developmental, educational, social, relational, pharmacological, psychological, and complementary and alternative. Some examples of types of interventions under those domains include applied behavior analysis or ABA therapy, speech language pathology or speech therapy, occupational therapy, physical therapy, feeding, day programs, group therapy or social skills groups or play groups, diagnostic services, social work and family navigation, respite and skilled community living or SEL, mental health therapy and psychology, parent coaching and caregiver training, group homes, school-based services, pharmacological, and alternatives. So we're going to dive deep into each of those and discuss each one a little bit more in depth. Starting off with my specialty, which is applied behavior analysis or ABA therapy. This is a therapy based on the science of learning and behavior. ABA therapy is the #1 most effective and only research-based treatment proven to significantly improve the lives of individuals with autism and other special needs. It applies the principles of behavior to produce meaningful change in socially significant behaviors. This is done by carefully examining the relationship between the environment and the behavior. And by doing this, it allows us to evaluate and determine the why a behavior is occurring. Then we can work to modify that behavior in a positive manner by teaching appropriate replacement skills. Essentially, the goal of ABA therapy is to decrease challenging or interfering behaviors while increasing skills needed for effective communication, learning, and everyday living. ABA therapy programs provide the behavioral intervention and treatment in different forms depending upon each child's and family's needs. So in ABA therapy, each individual will have a personalized and individualized treatment plan that is created after a detailed assessment has been performed by a board-certified behavior analyst or BCBA. ABA therapy is typically implemented through a team-based approach, and that would include a BCBA and then trained registered behavior technicians working together and helping each child reach his or her goals. Treatment sessions can be conducted in a variety of formats. Typically, it is a mixture of discrete trials training where it looks like the therapist and the child sitting at the table doing different activities or academics, paired with natural environment teaching formats. So it looks like the child and the therapist are just playing, but they are in fact working on vital skills. Teaching formats are based on each child's individual learning style. Some areas targeted through ABA therapy can include functional communication and language, visual discrimination, imitation skills, appropriate play skills, self-help skills, potty training, motor skills, pre-academic skills, social skills, observational learning, generalization, and caregiver training. And ABA therapy can be implemented anywhere, but typically you will see ABA therapy implemented in the clinic, the school, the home, and out in the community. Next, we're going to talk a little bit about occupational therapy. This is a field of therapy that's dedicated to ensuring individuals can do the activities they need to do each day, as well as the activities which bring their life meaning. So essentially, occupational therapy is being able to do your occupation throughout the day. With kids, their occupation is play. And so in a pediatric setting, the skills targeted in an occupational therapy session would be activities of daily living, or ADLs. So this could be brushing teeth, brushing hair. They can work on self-dressing skills, so focusing on doing fasteners, buttons, and zippers, being able to dress themselves, tie their shoes, and they can even focus on academic skills such as handwriting or cutting with scissors. And within these areas, occupational therapists typically work on the activity-specific skills as well as foundation skills, which include the areas such as the fine motor strength, coordination, balance, visual perceptual skills, ocular motor skills, sensory processing, executive functioning, which would also be instrumental ADLs, and then cognition and body awareness. Next, we're going to talk about feeding therapy. This can look different depending on the organization or the individual's needs. From my experience at Access, our occupational therapists are the ones that are performing the feeding therapy sessions, and they use the SOS approach, which stands for sequential oral sensory. So I'm going to talk about this approach because this is the one that I know most about. The SOS approach to feeding is one of the most well-researched methods to tackling difficulties with feeding in mealtime. In this approach, they utilize the steps to feeding and then systematically introduce new foods to the child while working on both the sensory processing and the oral motor skills that are needed to independently participate in self-feeding and mealtime activities. So I'm going to list a few red flags that may warrant the need for a feeding evaluation. Difficulty gaining or maintaining weight, consistent choking, gagging, and or coughing during meals, frequent issues with vomiting, inability to transition to baby food purees by 10 months, inability to accept and eat table food solids by 12 months, refusing entire categories of food groups such as proteins, vegetables, or refusing certain textures such as hard foods or purees. Almost always requiring a different meal at meal times than the rest of the family, having less than 20 foods in their repertoire, and then frequently getting burned out on foods and having to take a break from them.
I'll add you want me to go ahead?
Yes,
Okay.
go for it.
Okay. I'll add just a little bit too. Our occupational therapists here at ChildServe also utilize that same approach, very similar to what Kristin was talking about. We also incorporate our speech language pathologists into our feeding therapy, and they do a lot with the mechanics of chewing and swallowing. So if we see children or young adults that are struggling with many of the same things that Kristin outlined, we'll also recommend that they have some oral motor therapy or treatment that might also couple nicely with the sensory feeding in order to make sure that they're healthy and thriving for just the activities that they need throughout the day. So very similar approach to that. And I think most speech language pathologists can also do that oral motor portion of the feeding therapy. It does require some training. So I think speech and language pathologists specifically would seek out additional training to be able to provide those services on top of some of the other things they've learned. All right, next we'll transition to speech language pathology. This is my field of study and what I've practiced for over 20 years. Much like ABA and occupational therapy, you'll see a common theme. We do a wide variety of things, and we'll have speech and language pathologists that can do all of these, and you will have some that are specialized in a certain area, such as feeding. We see that a lot, especially if you have a large team of therapists. You may have somebody that's more of a social pragmatic expert or a feeding expert, but typically most speech language pathologists can do all of these different modalities that you see mentioned here. So for instance, articulation, I think, is the most commonly thought of type of treatment. When you think of speech language pathology, you think about the days in the schools, and I did a lot of this in the schools where I treated articulation errors or speech errors. But really also speech is much more comprehensive than that. We do see kids for fluency or stuttering, also language, which really pairs nicely with our ABA services, and Kristin can attest to that too, I'm sure, where we really can work together hand in hand with the ABA therapists to tackle what are their specific receptive understanding and expressive needs so that we can make sure that child is thriving in those areas. We also can specialize in voice treatment. So a lot of times you see this more in the adult population, but there are sometimes that children will struggle with a hoarse or raspy voice. Vocal cord paralysis could cause a number of things that we need to target. So there are times where that, although less likely, we would be able to treat that. Social or pragmatic skills. So we'll talk in a bit about some different types of treatment for this, but it can be done on an individual and group level. So social language can be taught in a variety of scopes of service. Speech language pathologists will work on this. It's very skill-based. ABA, occupational therapy also can do some work with social skills as well. So this is a pretty important and part of our treatment, at least where I am at, is as kids get older, even when they're younger, working on play skills that feed into their social skills as they get older. So I would say this is a very big area and common area for individuals with autism. Feeding therapy, Kristin talked about a little bit, as well as AAC, which is our augmentative and alternative communication. And this is also one that is a great team approach. So we like to incorporate our occupational therapists from a fine motor standpoint, our ABA team, in order to they get more time with the child. So they're able to really focus on some more specific data and goals related to AAC use. And our speech language pathologists really are the experts in what type of language system might work best and setup might work best for the child. So all of these are so very important, and we specifically love when we can get some specialists in the door that really can speak to these types of modalities. Kristin, anything you want to add for this?
Yeah, I do. Thank you. I just want to add in that you guys will start seeing a little bit of theme of, as we talk about all these different types of interventions, there is going to be a theme of a lot of overlap where we talk about this can also, we can do these, work on this also in ABA, or we're going to go to the SLPs because we need their professional input on this certain domain. And so when you have a child with autism, you are probably going to be seeking out a lot of different supports. What's very important and will contribute to more success is when all of those providers are on the same page, and the importance of collaboration, which we are going to talk a little bit more later on in this presentation. But yeah, I just wanted to point out that you'll hear a lot of, especially like speech, ABA, and OT, there's a lot of overlap in working together.
Yeah, for sure. Great point. All right, next we'll add physical therapy to the list. Probably not as common, but however, very important for children, especially when you're looking at balance and coordination. It couples very, very nicely with occupational therapy. I think their scopes overlap quite a bit, although I know even in ABA therapy, you're oftentimes looking at gross motor skills as well and what you can address with that. So it's great to have a team of experts that you can bounce ideas off of in order to get those goals aligned and so the child can make the most progress. So you'll see here some areas of specialty. There is things that I can't talk about as well because I'm not a physical therapist. However, I know that we do them. So you'll see the specialty areas listed below. Some things maybe people are more familiar with is concussion. So we do see kids post concussion, and we have a medical provider as well as a team, OT-PT speech, that evaluate and can treat that. Aquatics is another great area, I think, for a lot of children benefit and really love aquatic therapy just because they get to be in the water and it's just a great input for their system. Serial casting, some other benefits there you'll see in the special areas for strengthening and coordination. Home exercise, honestly, for physical therapy, not that it's not important for every service, it is important for every service, but specifically, I think for physical therapy, you think of this, if you go to a PT appointment, you get exercises you have to do. And I think that that's important for this program as well. So you'll see some fun pictures along the way of just some different equipment that is utilized in some of these services too.
I just want to add in that we get the question a lot, what's the difference between physical therapy and occupational therapy? And the way I like to explain it is physical therapy is really, in my opinion, building back up the strength and the certain parts of the body and the muscles that are needed to be able to do the skills, while occupational therapy is the teaching of those skills. So an occupational therapist could be teaching a child to ride their bike, to ride a scooter. However, if they don't have the strength, or they are recovering from an injury, or they don't have the certain coordination be due to their muscles or just the structure of their body, then they could possibly also need PT to build those up and get stronger.
I think you're up for groups, Kristin, if you want to start.
Sure. So group therapy, I will talk a little bit about. So social skills groups are when you have a group, it could be as small as 3 people, it could be as large as 10, but you're going to be all focusing on a goal. At Axis, it is our ABA team that leads and participates or provides these social skills groups. So typically the registered behavior technicians that are overseen by the BCBA, and it is a group of individuals with common strengths or areas that they want to learn. So based on the needs and the goals of those participants, social skills groups may focus on initiating interaction with peers, maintaining friendships, forming friendships, navigating peer relationships, initiating or maintaining a conversation, appropriate language or behavior to be used in social settings, gameplay, how to win and lose gracefully, collaborative group projects, identifying feelings, managing your feelings, recognizing and responding to emotions in others, learning how to take perspectives of others, conflict resolution, anger management, coping skills, and dealing with bullying. And then in our younger population, we call these more play groups. And this is maybe preschool aged, early elementary. And while the same concepts, the things that we typically focus on are the initiating appropriate interactions with your peers, effective listening, communication, learning how to take turns, whether that be with activities or toys or in a conversation, cooperative play, playing how to appropriately play together, how to be a good friend, developing appropriate play skills, again, gameplay and group games, identifying and expressing those feelings, emotions, anger management, coping skills, following direction, impulse control, frustration tolerance, attention span, all of those things can be targeted in social skills. And then as you progress through life and they get a little bit older, social skills groups may focus on, we've done anything by how to plan a party, how to attend a party, like prepping for job interviews, prepping to go on dates, and essentially just where they are in their life and what social skills they may need to work on in a more controlled setting before going out there into the actual natural environment. And then there are life skills groups as well, and these can be groups for adults. Again, they can come together and learn skills for that area in their life. It could be cooking, cleaning, making doctor's appointments, going to the grocery store, really, again, any social skills that that individual would need at that time in their life. Moving on, we'll talk about educational supports, and these can vary among individuals as well as among schools. Some types of supports include, if the child qualifies, they may receive speech therapy and occupational therapy in the school setting is typically what I have experienced. From my experience, occupational therapy is very hard for a child in school to qualify for. Speech is a little bit easier. Very rarely have I seen PT in school. And then ABA is, again, from my experience, if there is a mutual contract with the ABA provider in the school, or if the parents have specifically pushed for the providers to be in there to train the staff or the para or something like that. It could be teaching strategies, special education services, IEPs, which stands for Individualized Education Program. And the purpose of an IEP is to lay out that special education instruction, the supports the child may receive, and then the services that student needs to thrive in the school. A 504 plan is a plan that the schools develop that gives a student with disabilities the support that they need. That could cover any condition that limits any daily activities in a major way. And it often includes accommodations, and those could include changes to the environment, such as the student can take their test in a quiet space, changes to instruction, like the teacher checking in frequently with the student on key concepts, or it could be changes to how the curriculum is presented, so the student could receive outlines of the lessons. Lastly, there is autism specialists and teams, and this could be provided sometimes through the AEA. Things that it would be positive behavioral interventions and supports, if anybody has heard of the PBIS, or if there are safety concerns of the student safety or individuals around the student, they might have some kind of physical crisis intervention plan for the child.
Kristin, there is a question in the chat about why it's so difficult to get OT in the schools. I don't know, generally speaking. I know in Nebraska, way long time ago, it was a lot of times because the modalities that they look at for the school setting, it has to be attached to an educational purpose or reason.
So typically it's if what would warrant OT in the school setting is if that specific skill deficit is interfering with them being successful in the classroom. And yeah, again, that's very hard for somebody to identify. Typically it's they can find accommodations or ways around it. But if it is actually prohibiting the child from actually being able to do grade level work or what they should be doing, their IEP, they probably won't receive it in school.
The more typical things I see are handwriting. A lot of times in the middle school setting, they would work on locker combinations and accommodations there. Seating, sometimes being able to sit and attend in the classroom. I'm not sure beyond that. That was the main things that I was aware of.
Yeah.
Okay. Great. All right, moving on to pharmacological. And once again, Kristin and I are not the experts on all of these. We know a little bit. We make a lot of referrals. We refer to our specialists in these areas. I do know I have presented with our psychologist, Dr. Richards, on this topic many times, and she's much more of an expert than me. The thing I'll say about a lot of these things you see listed is a lot of times left untreated will result in some challenging behavior. And so a lot of times when you see that challenging behavior, a good place to start is to think, what could be causing some of that? Could it be medical? Are there medical reasons why this child is having a difficult time with whatever community or daily activity that they're trying to participate in? So I think my main take home with this in a nutshell, that we have a whole presentation on it, but is just to really think through what sorts of supports. Not always is a pharmacological support needed for these. It could be other things. Like I know our occupational therapists work with sleep, maybe ADHD, trying to work on focus strategies. So it's not always that you have to go to this extent to treat it pharmacologically, but it is an option out there through psychiatry and other providers that are able to help with that. So it could be a potential referral you see if you're noticing changes or challenges. I'm not sure, Kristin, if you have anything else to add to that. No. Okay. All right, moving into the behavioral health realm. Once again, we're not experts on this, but we work with these professionals a lot, make referrals to this professional a lot. So mental health therapy can extend and expand on work that other outpatient therapists, so this is what I see in our setting, is that a lot of times if I have a client that is, I'm seeing that they need some additional support besides my scope of practice as a speech language pathologist, then I will refer them on to mental health therapy to help work on those things. So some things that they might work on there are navigating emotions, coping with their environment, any trauma history or things that have been traumatic. It can help families and just young adults and children work through those challenges together. So we do a lot of parent training in our rehab and our ABA services. However, this can be more specific to what plan would be for that family member as well, or caregiver in that regard. So really their scope is as wide as everybody else's, and I wouldn't begin to cover everything that they're able to offer. Parent-child interaction therapy. We do specialized programs for autism and just new diagnosis and how to cope, kind of navigate that change. So there's just a variety of supports that are available with mental health therapy. So here's some additional things I had kind of touched on. There's family therapy, individual therapy for children and parents. Here's some different modalities that are used. And then also group therapy. So that's something that I know our behavioral health team does. They do social skills, they can do parent groups, they can do support, different, even yoga. We've done a yoga group before for trauma-informed care, just a yoga group that had an OT and a mental health therapist doing that together. So lots of creative ways that you can pair mental health. Another creative way is we've done a collaboration with mental health and occupational therapy for feeding. So a child that you might be seeing some anxiety around feeding, but also some of the sensory things that Kristin talked about. We've coupled those together and worked with those professionals to try to create a great treatment plan for that as well. So other services, we've kind of labeled a lot at the very beginning. So Erica Hertel introduced us, and she could speak much better than us about the family navigators that they have for the regional autism program, but they're available. Please use them if you have questions. They're wonderful. Every portion of the state has one on staff, and can reach out and just ask them any questions, from resources to advice. Many of these family navigators also are a parent or a caregiver of a child or young adult with autism. So they've been through a lot and would be able to help in that regard as well. So if you have questions, reach out to Erica later. Erica, if you want to put your email, sorry, I'm putting you on the spot, didn't plan this, put your email in the chat for anybody that might be interested in family navigation or have questions in that regard. Some other services to consider that are in the community are respite services. So children that have waiver services may qualify for respite or just a break for families and caregivers. It's a very valuable service, one that we see a lot of families take. Sometimes a family member is a caregiver that's involved is the respite provider as well. We've had siblings that are respite providers, so a really valuable service under a waiver system. Skilled community living is similar, except that it's much more goal-oriented. It's in the community, and they're working, young adults and children are working on goals related to daily living. So this is another branch off of a traditional therapy program where they can extend that into the community and actually generalize and use some of those skills they're learning, whether money, laundry, cooking, you name it. There's a variety of skills that attending a movie, lots of things that they can work on in the community with SCL services as well. We have residential settings that a variety of organizations around the state provide as well. So that's more of a 24/7 type of care for families that might qualify for that service. And then there's a variety of alternative treatments out there that we won't even go into, but if you Google search, you can find it all. It's just kind of evaluating what works for your family and what you kind of want to pursue at that point. All right, so we're going to move away from what are the different types of services and talk more about how to navigate those, how to work with your team members, things Kristin and I can speak that we've learned through the years of working in a team setting. We really want to give this information to you so you have that going into whatever journey you have. So really the first point is just, what is effective treatment planning? We talk about it. We talk about evidence-based programming. What should you be looking for? What's the bottom line? If you're looking at the variety of services out there, what should you focus on? I think both of us could attest to that it should be child specific. So it shouldn't be a blanket, here's for everybody and this is your program, because we know each individual is unique and should have their own roadmap, and we want to be here for that, and we want to make it specific to you. It should be evidence-based, so we talk about that, but there's research behind it. Kristin talked about ABA being very researched and evidence-based as a practice. And so each individual scope, speech, OT, have evidence-based treatments that they can provide. So I think making sure that it's something that has that evidence or research behind it. It's team focused. So like we've talked about how important a team is. I think when you go and you are looking at things, you should listen for how people talk. So if you walk into an organization or a place of service and they're talking about their team members and you're seeing people work together, I think that's a huge bonus that you should be looking for. It should be something that works for your family. I know we're all busy. It shouldn't be something you feel like you have to do, that just because somebody says that. I mean, I think it needs to work for your family. So it needs to fit in. It doesn't need to cause too much additional stress. Everything's an additional stress. But, if it doesn't feel right, then don't do it. It really needs to work for you. There should be long and short-term goals. So your clinicians or providers should definitely be talking about what you can accomplish in a short amount of time, but also thinking out into the future and what long-term might be. Even though that's hard sometimes to talk about because it's hard to get there, I've had families really appreciate the fact that I'm thinking about their future and talking about, here's some things we want to work on now so that we know it'll impact you in the future. And then just talking about transitions and changes consistently. So, making the families and the team a part of those transitions and talking through those and answering questions. All right, we'll move over to Kristin for types of approaches.
I'm going to talk about the multidisciplinary team approach, and this is when a mix of health and care professionals come together and plan and coordinate an individual's care. So this could include, for example, the BCBA that's overseeing the ABA program, the OT that's overseeing the occupational therapy plan, the PT, the physical therapist, the SLP that's overseeing all of the speech goals and treatment, as well as the school team. So the child's special ed teacher, classroom teacher, and even the child's associate or paraprofessional that they may have at school. In the multidisciplinary model, each discipline sets patient care goals according to its field of expertise, independent of other professionals. In this approach, each discipline works independently and reports to the group specifically on their service area. So this would be the BCBA comes to the team and reports on what they are working on in ABA or what their ABA assessments found. In this approach, not only should each member of the team have expertise and professionalism when working with those clients, but they should also be able to work cohesively and productively with the other team members. Some benefits of this multidisciplinary team approach include improved client outcomes, streamlined workflows and time saved, and improved client and team satisfaction.
In an approach maybe that's more a recent word that people have used, it doesn't make either really right or wrong. I think it's how well you would do either of them, but you might hear both of these as you're talking to your team. So it isn't a matter of right and wrong. It's just a matter of how that team does that and is it effective. So I know here at ChildServe, we use some multidisciplinary approach just based on time and availability and how it's set up. And then some other areas we're a little more interdisciplinary. And so I assume, Kristin, that's kind of similar to how you guys operate as well.
Yes. Yeah. So yeah, within Access, we do a lot of the interdisciplinary approach. Even if the child isn't receiving all services with us, we love to incorporate, say the child is getting speech therapy at ChildServe. We want to talk to that speech therapist. We want them in on this child's overall plan so that we can, again, get their input on where their expertise lie, and vice versa. We want to be able to help them. Say there's interfering, challenging behaviors, we want to be able to support so that those sessions can go much smoothly for that SLP as well.
I agree. It just reminded me that we have talked a lot about how sometimes it's unknown to people that other organizations can work together too, and having a collaborative and open communication is super important. And I think both you and I and some other people we've worked with value that. And I think that's been very successful for our community as well.
Absolutely.
So, yeah. So just like Kristin said, interdisciplinary team approach is more of a continuum. So you may have one treatment plan, or the treatment plans may be combined into one where you're addressing a goal that speech language pathologists are giving input on and also addressing. So you're collaborating in that regard for one singular goal. It may be like everybody's working towards what are the language goals, everybody's working towards what's the academic goals. This one's much more time consuming and I think more effective maybe in a smaller team setting. However, can be very beneficial, especially so you're not working on different things. We do a lot of rounding here to make sure that we're not way off base between our different services on the ultimate goal for where the child or young adult's functioning level is and where we kind of would, where we're headed. So we do try to do some of those collaborative rounding in organized ways to come up with a singular goal. I think I see it more effective, at least easier to do in AAC when we're trying to choose like a speech generating device and working together that way. I'm not sure, Chris, if you have other examples of how you've seen that.
Yeah, and you talked a little bit about that with the feeding. So we had a client a couple years ago that they had a feeding program, but we also needed the speech therapist in there to work on the oral part. And we actually needed the BCBA in there as well to work on some skills when it was appropriate ways to sit and have a meal. And so it was all three of those disciplines working together on one goal for the child.
It's a great illustration. So some things to consider with this: family members are a part of the team, and they should be with the multidisciplinary team approach too. It should always be that way. The family caregivers are a part of the team. Team members will collect and review data together at times, and also kind of the results of that intervention, just like some of our examples show in the integration and consensus, I think is the biggest thing. And there's some challenges with this that aren't always easy, but when you have a multidisciplinary, interdisciplinary team, but really the goal should be that we all agree that this is the goal and this is what we're working toward, and the methodology to get there. So basically this is just another highlight of a group of individuals from different disciplines working and communicating with each other. It's kind of the definition. Each person brings their own knowledge base. So generally speaking, all disciplines might generally know about a modality such as AAC or language or fine motor, but you're really taking and gathering those expertise and bringing them to the conversation to support the contribution of the whole team together. And then really the design is to work on common goals to improve outcomes.
I'm going to talk about some collaboration musts. So when you have that team of different individuals and different providers from different disciplines, as well as the family, there are some tips that I'm going to share of how you can work together effectively. So some collaboration musts would be teach other team members what we do. So as a BCBA, my role is going to come in and talk about my expertise, but I'm also going to need to be open and willing to learn what others do so that I can incorporate their expertise into my area. We want to be able to provide constructive feedback as well as receive that constructive feedback, and then recognize and utilize that overlap between roles. So what I talked about earlier is I need to be able to, as a BCBA, respect and hear what Leslie has to say if we have the same client that is coming to me for ABA, but is going to her for speech. We need to be talking about what our goals are. Are they in line? Are we using the same techniques? Are we not inadvertently going against each other and teaching different methods that's going to confuse this child and slow their progress down? So some tips to help you work together effectively is to define your goals and roles. It's very important to clarify goals and define everybody's roles. So make sure everyone's on the same page about what you're trying to achieve and what each person's responsibilities are. This will help avoid confusion and ensure that everyone's working toward the same end result for the child. Communicate openly and frequently. Communication is the key to successful collaboration. Make sure you're communicating openly and frequently with the rest of the team, with your collaborators. Be clear about your ideas, ask for feedback, and listen to what others have to say. And do not be afraid to raise concerns or ask questions if something isn't clear, or again, like Leslie said, if something doesn't feel right, you don't have to just blindly follow. Build trust and respect. These are essential components of effective collaboration. Treat your team members and your collaborators with respect, listen to their ideas, and be open to constructive criticism. When everyone on the team feels valued and heard, it will create a positive environment that will help foster that collaboration and innovation. And then lastly, use collaboration tools. So there are many tools that are available to help with collaboration effectively. So if you're not within the same organization, you're going to need to be sharing files. So there are file sharing platforms, project management software, communication apps. These tools will help you stay organized, efficiently communicate, and to share information easily and confidentially and HIPAA compliant. But choose tools that work best for your team. Make sure everybody is comfortable using them, and that everybody can stay on the same page. Next, I'm going to talk about, sorry.
We have a quick question in the chat, and I can also answer this too, but if you have an answer, how do you support family members being involved in the success of the child therapy if English is not the primary language spoken at home? It's a great question.
Yeah, if you have an answer, go ahead.
Sure. Well, I was just thinking about, this can be challenging. A lot of our parent training that we do, it's not translated the handouts and everything we need. So we do our best to utilize Language Line. We have specifically, we have iPads with, we can access Language Line with a lot of different languages on it to bring into the session if we need to spur of the moment or planned. We do utilize live interpreters at times. We can schedule them if we need them for those appointments. So I think we try to do our best to gain access to those types of resources. We have translated some things into Spanish and French. Those are the most common languages. However, I know that does not reach the community in general. So, you know, that does make it a challenge, as a lot of our resources we have and handouts aren't translated.
Mm-hmm.
So I don't know if you have anything to add to that, Kristin.
We do the same, is we'll try and find interpreter services, whether it's written or live. So we do the same.
Okay, great. Good question. All right.
All right. So lastly, then we're going to discuss team bonding, some guidelines to team bonding. So a vital part of a strong treatment team is a strong relationship, and this starts with team bonding. So some guidelines to team bonding are to acknowledge the possible problems that could arise throughout the collaboration or throughout the timeline of the treatment plan, to understand each other's scope of practice and to respect that, to understand differences in theoretical frameworks. So fields can be very different, and it's important to acknowledge that, and you may not agree with it, but you do need to respect it and try to understand. Acknowledge strengths and limitations, not only with others, but within yourself. Leave baggage at the door. You remember, this is for the child and the family. They should always be at the forefront of what you guys are working together on. To complement and collaborate, to engage in lifelong learning, and most importantly, advocate for the children and the families that we are serving.
That concludes our formal presentation. So I will stop share, and we would move into any questions that you guys might have, I believe, Erin.
Yeah, if anybody has any questions, they can either type them in the chat or the Q&A, or you should be able to unmute yourself if you want to just ask your question out loud.
I can put my email in the email in the chat too. Was that what you're going to say, Kristin?
I was just going to say, if people don't want to ask live questions, if
Yep.
they want to ask specific to
That
either
would be
one of us or
fine.
both, we can put our email addresses in the chat.
That'd be perfect. And everybody who is registered will get an email this week or early next with the recording, any valuable information that you guys are willing to share, and contact information, so everybody could be expecting that.
Yeah. We appreciate the Autism Society of Iowa continuing these April webinars. I think they're fantastic. I think it's great to have the recordings of these presentations. I appreciate everybody taking their lunch hour to learn with us. Both Kristin and I are open to questions. If we don't know the answer, I am certain we can find somebody in our community or place organization outside of here that can help answer that. So appreciate everybody's time today. Oh, the chat moved. Kathy says the chat moved when I stopped sharing the screen, Erin. So I'm not sure if people can see Kristin and my email address in the chat now.
I can see it, so you probably
Okay.
click on chat again at the bottom of your screen and bring it back up. Yeah, that's right, Kathy. So,
Okay.
yeah, if you, and like I said, all the emails and everything will be included in that, in the email that will go out.
Okay, great.
All right, one last call for questions. If we don't have any, we can go ahead and go eat some lunch.
Well, thank you,
right.
everyone, for being here.
Yeah,
Yeah.
thanks. Thanks, Kristin.
Welcome. Thanks, Erin. Thanks, Erica.
Like I said, the email will go out late this week or early next.
Okay.
Thanks, everybody. Have a great day.
Bye.
Thanks, Erica.
You're welcome. Bye-bye.
Bye.